A major debate has erupted over the murder of United Healthcare CEO Brian Thompson over who exactly is the real villain. Joining me now is Sean Morrow, a senior writer at More Perfect Union, who has extensively covered the healthcare industry and insurers such as United Healthcare. Sean, thank you so much for being here. I went through some of the bill of particulars that a lot of people are pointing out online. There was one other piece that I think came from you, from a clip that I saw of you online that was, to me, really shocking. The fact that United Healthcare, they're almost operating like a payday lending service to doctors. Can you talk about that?
Yes. So when you look at United Health Group as a whole, which owns United Healthcare, who lost their CEO recently, they own many companies. And one of the companies they own is one that employs a lot of doctors. And as part of that, they have a company that gives what are basically payday loans to doctors that offer a bridge to these doctors so that they can fund their practices while they're waiting on United Healthcare to pay them back on these claims.
One of the things that you pointed out in the clip on More Perfect Union is that people just perceive doctors as wealthy. They perceive them as all super rich. But unless you're like a plastic surgeon, they're actually struggling in a lot of cases, right?
A lot of the doctors that are most important to Americans, like primary care doctors, are actually struggling. And when people say that healthcare needs to be cheaper, no one's saying that doctors should be making less money. Doctors should be making a good amount of money. The people that possibly should be making less money are the executives and administrators for the companies that are preying on people that just need healthcare.
So it seems to me that there are not very many healthcare companies. It seems like, you used to have Cigna, you used to have all of these different companies, Blue Cross Blue Shield. They've all consolidated. Like, how many actual companies are left in the market?
There aren't many, and when you think of the way they're consolidating, it's less a matter of multiple insurance companies consolidating to make fewer insurance companies, but it's the insurance companies buying up other parts of the system. So, of course, you have CVS and Aetna are now one company, right? And if you go to CVS.com to fill a prescription, they will have a quiz on there trying to sell you on Aetna insurance because of all of this consolidation and vertical integration among the companies. And the same is true at United Healthcare. They also own Optum, which is a chain of primary care physicians.
And I should know Blue Cross Blue Shield does still exist. There's some of them still exist, but as you said, they buy one another, and so they become part of the same conglomerate. How extensive are the denials? There is this clip here. United Healthcare CEO's parent company, as you called it, as you mentioned, United Health Group. This is their CEO, Andrew Whitty. This is an internal video that was leaked to journalist Ken Klipperstein. Take a listen.
Are going to make sure that we not only acknowledge and honour that legacy of Brian, but we will continue it. Our role is a critical role, and we make sure that care is safe, appropriate, and is delivered when people need it. And we guard against the pressures that exist for unsafe care or for unnecessary care to be delivered in a way which makes the whole system too complex and ultimately unsustainable.
The idea of unnecessary care. If you need anti-nausea medication because you can't keep food down, that seems to me to be necessary care, but they're still saying no in cases like that.
These gentlemen have something called fiduciary responsibility. That means they have to, of course, return as much money to their shareholders as possible. That's their legal responsibility, just like as journalists, your responsibility or my responsibility is to tell the truth and inform people. So if people are paying them a premium to pay for their insurance, and in exchange for that premium they're getting care, the company is going to make the most money for shareholders by providing the least care. So to them, it makes a lot of sense to determine things that are unnecessary.
And there seems to be some callousness. ProPublica did release and leak some video of a couple of nurses or people who work for United Healthcare sort of laughing about denying care. I mean, there's a callousness to the industry as a whole. I take it is not like this in other countries.
Yeah, it's not like this in other countries because this industry doesn't really exist, which is, I believe, a positive. Profit is not tied to healthcare. The quality of care you receive is not tied to how much an executive gets paid or how much money they're returning to shareholders. It's just based on what you need and what will make you healthy again.
If Medicare and Medicaid are ultimately privatized or TRICARE is privatized, how much will United Healthcare benefit from that?
United Healthcare would benefit quite a bit. United Healthcare is already in Medicare privatization with Medicare Advantage, which is when they convince the elderly with predatory dishonest advertisements that this private plan is better to replace the public plan. And that ends up ripping off the taxpayer. The taxpayer pays hundreds to thousands of dollars more per patient than they would on original Medicare, and it hurts the patient. People aren't getting as good care on these privatized plans that the incoming administration wants to try to switch more and more plans to.
And the idea of what they claim they're doing is efficiency, but consolidation is supposed to deliver efficiency. I take it does not.
I mean, it delivers efficiency, but their definition of efficiency is returning as much value to their investors as possible.
There you go. Sean Morrow, a great journalist. I hope you will come back often. Thank you very much. I think we're going to be having this conversation a lot. Thank you.